Hello and welcome to NCLEX Prep Class. I am the best teacher to guide you through your NCLEX preparatory. Stay tuned. Question number 1. A patient is admitted to the surgical unit with a diagnosis of rule-out intestinal obstruction. The nurse is preparing to insert a Salem sump NG tube as ordered. In which of the following positions would it be best for the nurse to place this patient during the procedure? 1. Head of bed elevated 30 to 45 degrees. 2. Head of bed elevated 60 to 90 degrees. 3. Side lying with head elevated 15 degrees. 4. Lying flat with head turned to the left side. Which is the correct answer? 1. Head of bed elevated 30 degrees to 45 degrees. While this position is commonly used for NG tube insertion, it is not the best in this scenario. A higher elevation is preferred as it more effectively uses gravity to facilitate tube passage and allows for easier swallowing. This photo shows a patient on a bed elevated at 35 to 40 degrees. Option 2. Head of bed elevated 60 degrees to 90 degrees. This position maximizes the use of gravity, facilitating easier passage of the NG tube through the esophagus into the stomach. It encourages swallowing, which helps the patient cooperate with the procedure and ensures proper tube placement. It also reduces the risk of aspiration, which is particularly important for a patient with a possible intestinal obstruction, as they are at risk of vomiting. This photo presents a patient at 60 to 90 degrees elevation. Remember, this position facilitates easier passage of the NG tube through the esophagus into the stomach, encourages swallowing of the tube into the stomach as well as reducing the risk for aspiration. Option 3. Side lying with head elevated 15 degrees. This position does not adequately support NG tube insertion. The low head elevation, 15 degrees, increases the risk of aspiration and misplacement of the tube into the airway. Side lying is more appropriate for patients who are unconscious or at risk of aspiration but not for NG tube placement. This position is more suitable for patients who are unconscious or at risk of aspiration. 4. Lying flat with head turned to the left side. Lying flat is dangerous in a patient with suspected bowel obstruction, as it increases the risk of aspiration if the patient vomits. Turning the head to the side does not aid in tube passage and can increase the risk of misplacement. This is an unsafe position for NG tube insertion. This photo presents a patient lying with head turned to the left side. Which of the options did you go for? Head of bed elevated 60 to 90 degrees. This is the best choice based on positioning strategy for effective and safe NG tube insertion. That brings us to the end of today's class. In our next lesson, we will discuss the indications for nasogastric tube administration. If you found this session helpful, don't forget to like, share, and subscribe so you never miss an update. See you in the next class.